Now, Solidarity has launched a court case against the University of the Free State on its vaccination policy, which compels students and employees to get the COVID-19 vaccine. The union says the blanket approach on vaccinations is a violation of human rights and does not take into account the unique situation of individuals. Now, let's discuss this further. We are joined via Zoom by Solidarity Research Institute head Connie Mulder. Mr. Mulder, thank you so much for your time this afternoon. Now, we know that a lot of universities have taken this stance. Why are you singling out the University of the Free State, as it seems?
Thank you, Winati. I think before we start this discussion, we first need to state Solidarity's position on vaccination, which is simple. We are on public record that we encourage our members to get vaccinated. We think vaccines are safe and effective at reducing COVID-19 hospitalization and death, less so effective, unfortunately, against Omicron in reducing transmission and infection. But, however, we've been against mandatory vaccination from the very start, based on several key points. The first being, of course, that the Department of Labour's own directive state you cannot do a blanket approach where you just arbitrarily top-down state all employees need to be vaccinated or else. Ensuring a safe workplace is a cooperative effort between employer and employee, and there needs to be an individual risk assessment of each individual employee's work and health circumstances to then state, I think it's critical that you get vaccinated in order for you to do your job. The burden of proof on an employer who wants to force an employee to take a medical procedure is actually quite high. And going about it as recklessly almost as the University of the Free State did with just stating this is now mandatory is something that we've seen in several employers, and we now need legal certainty based on this. The University of Free State specifically was chosen because we have several members there who are quite unhappy about the policy. Their vaccination status differs between people who are vaccinated and those who aren't, but for the simple reason they're stating this was not done correctly. We're taking this court case. We had more than 300 requests from members in December just to get legal certainty regarding what can an employer force you to do or not. So from our perspective, it's just getting legal certainty on the labor side. Can you actually force an employee? Unless, and we fully accept there might be exceptions in, for example, the healthcare sector, where an employer can actively make a case and state it is critical for you to undergo this medical procedure in order for you to do your job. From our perspective, the vast majority of employers have several other measures that they can take before we get to the absolute extreme, which is mandatory vaccination.
So I can hear your stance as Solidarity in terms of, how you feel as far as vaccinations are concerned. But we are in a pandemic. I mean, the WHO has also warned that even though the Omicron variant may seem as though it's not as severe as other variants, the threat still exists in terms of other variants coming to the fore, particularly as it relates to those that are not vaccinated. Do you not see this in any way as almost like a health crisis where universities are also, stuck in terms of what are the best measures to take, and they therefore look at what's in the interest of those that are perhaps vaccinated and then take their stance in that way? Do you think that this measure, which you are calling extreme, is probably the only way in which institutions can deal with this pandemic?
Well, I think we don't think it's the only way. There are several other ways to get your vaccination rate up. And it's exactly because we're in a pandemic and we're going to be living with COVID for a long time that we're taking this position. Apart from the labor problems and the legal certainty, we did extensive research on successful vaccination programs internationally, and it quite simply is not true that mandatory vaccination is necessary to achieve your vaccination targets. We're extremely worried, given the polarized debate in South Africa, that if you start mandating vaccination now, you are scuppering any long-term efforts to get vaccination rates up. If you look at the University of the Free State specifically, young people between 18 and 34 in the Free State have a vaccination rate of roughly 40%, which means you're trying to force 6 out of 10 students to get vaccinated. What we've seen in other countries is mandatory vaccination entrenches and hardens resistance. And whilst we might need vaccination now, we will most likely need a booster at some point in the future. And forcing 6 out of 10 people now only means you're going to be forcing 7 out of 10 or 8 out of 10. If worse comes to worse, we're going to see massive protest action, which then politicizes the vaccination debate and scuppers any chance we have of getting to group immunity targets. The second point would be post-Omicron, we had a lot of South Africans that got sick and got better. And we need to stop focusing on vaccination as the only thing and look at immunity. Whether you got it through natural immunity or through vaccination, our vaccination targets can realistically be adjusted downwards. If we can believe Prof. Shabir Mahdi, who states almost 75% of South Africa has already had COVID, that means there's a large reservoir of natural immunity. And that's why we're stating a pandemic is an extremely complex situation. There are no simple solutions like mandating vaccines. Vaccines are a critical part, but it's a critical part on a much longer scale than only now getting through one wave. And if we are to then be able to successfully have health interventions with each successive variant, we cannot now mandate and erode trust and politicize the debate. We need to make sure that people are treated like adults and given good information, and then we need to trust their choices. At the moment, the main source of vaccine hesitancy is just plain people stating, I'm unsure about the side effects, or it's too far to go to a clinic. Now, these are things that we can address with good information. Solidarity has published 3 reports on vaccines in which we try to address all of our members' concerns.
Mr. Mulder, if I can interject, Mr. Mulder, if I can interject, you've mentioned quite a number of times, in fact, that you've seen with some of the trends that are happening in the international space. There are some good ways in which we can encourage people to vaccinate, and those have worked in those other countries. I mean, one of the things that I know officials in South Africa have always asked for and called for is, what are these ways, these interventions that we can bring to the fore so that, the majority of South Africans are, therefore, safe and vaccinated. Yes. So what are they? What have you found? I mean, can you also probably draw some of those trends in the study that you have conducted yourself?
Yes, exactly. I would like to use Solidarity as an employer as the example. What we did, Discovery would be the other one, is we held extensive information seminars. We gave good information and we updated regularly, and we were extremely honest about, yes, there are side effects. They might be severe or not, but the risk is still, for the vast majority of people, much higher from COVID-19 than from something else. And then explicitly stated, we're not going to mandate vaccination, and we're not going to discriminate based on vaccination policy. This is the same approach that Portugal, Denmark, and Spain has followed, and they're sitting with vaccination rates of almost 90% of the population, just based on a voluntary choice situation where you treat people like adults. Solidarity itself is sitting on a vaccination rate of 86% of our employees who vaccinated voluntarily. The rest just plain couldn't because they recently had COVID. So there's a large measure of stuff that we can do. One of the main problems is we had a sort of non-existent marketing campaign for vaccination due to financial struggles from the Department of Health, due to several contracts, and we know all about that sort of furor that happened. But what we're suggesting in South Africa, quite simply, is our studies show, the UJ study as well as several others, the government is not trusted with information anymore nearly as much as community leaders or other institutions. And that means we need to decentralize vaccination down to literally your GP level. If I can go to my doctor and he or she can prescribe vaccination and say, this is a good thing and I trust it, and I can get it right there in the office, in his office or in his surgery, that changes the situation significantly. It's an institution that's still trusted by the vast majority of South African citizens. Now, this is steps that we can take. For the University of the Free State, that would entail having intensive information sharing seminars where you engage with actually employees and students as family, because that's what we've seen. If Discovery South Africa is anything to go by, it's not just the one person. They've got a family and extended family who hold certain views. And the misinformation regarding vaccines is really sophisticated. It's difficult to cut through for the layman, but getting experts in who are still trusted would be the way forward. Now, we've been on this train from January 2021, where we stated for government in South Africa, for the vaccination program to succeed, you will need to get the private sector and community institutions involved, because that's where the trust lies.
Mr. Mulder,
this has been ignored. And the net effect is a low vaccination rate with large vaccine hesitancy. And now we're looking at the shortcut of mandating when there are so much more that we can do before we get
Mr. Mulder,
to that point.
do you think a court, taking the university to court is the ultimate, decision that you can take? Have you tried engaging a government? Have you tried engaging the university? Because, I mean, we've seen cluster breakouts in universities, and not everybody can afford to study online.
No, exactly. The problem is what we've seen with Omicron is that the risk of transmission has been severely reduced, unfortunately. So vaccines will not provide you the protection against infection or transmission that they did against Delta, and that means we need to reassess. Taking the university to court is quite simple. We need legal certainty regarding this, and we need to make sure that we're not going for short-term solutions that imperil the long-term success of a vaccination program and our handling of the COVID pandemic. And that is why, from our perspective, we cannot take every single employer to court, but we need some legal precedents. And we've got about 4 cases that we identified that would successfully address the situation of employers forcing employees without engaging a proper process and with limiting access to educational institutions and other public spaces, specifically for unvaccinated people. And we're really worried that if we're going down this route, we're going to scupper all chances of a successful vaccination program. We're going to be in a pandemic that never ends.
All right, Mr. Mulder, we're going to have to leave it there. Thank you so much for your time this afternoon. That is Mr. Connie Mulder from Solidarity Research Institute.